Hello, everybody. Welcome back. This is another video for year three. I have lost count at this point. So we're just going to go ahead and get started. One of the things I wanted to talk about in detail is a technique called behavior activation. But before I discuss the technique, I think I want to discuss the diagnoses that it has. Um, it is typically used to treat, and that is depression, right? And I want to talk about depression because a lot of people very much so struggle with depression. And depression can be very, very confusing. Some people function very well in depression and just not realize it. A lot of people are struggling with depression and they're calling it loneliness because it's couched in that, right? But you can feel lonely, but then not want to spend time with others. And so we'll just spend quite a bit of time talking about depression, and then we'll get into the behavior activation. So let's get started. Okay, so just like I was saying previously, depression can affect different people in very different ways, right? Because of this, it isn't a condition that can quickly or sometimes accurately be diagnosed, right? Some people may withdraw and stop interacting with everyone around them. Others might not display those kinds of symptoms at all, right? But have an unhealthy eating and sleeping pattern. Being irritable and anxious are also indicators that show up time and time again. Um, while depression is a mental condition, it can also manifest itself into a physical problem as well, which is why I wanted to bring about the conversation of behavior activation. Because again, some people may not recognize that these physical symptoms that I'm about to name are associated with depression, right? So in some cases, it can result into headaches and other pains. And sometimes those are called somatic, which are body aches, somatic pains. People can have stomach aches sometimes because of depression and anxiety and not realize that they're having those aches because of it. And of course, having an irregular sleep schedule can result into the feeling of sluggishness and maybe an even a loss of interest for a lot of people. So, something to remember is that there are levels to the symptoms too, right? So, there's mild, moderate, and severe depression. It's even classified as single episode. Recurrent means it happens over and over again. It's just kind of you have highs and lows. No, I don't. Yeah, well, highs and lows, or you just kind of have a midline blah feeling and then more depressed. But we can discuss those in a minute. So, on the extreme end of things, a person's physical well-being will begin to nosedive as they continue to neglect their health. So, depression rears its head in many different forms, and it's important to keep that in mind. So, how you know that you fit into the diagnoses of depression. So typically they give you a list of symptoms. And if you have, and I'm just using this as an example, if you have 7 out of the 8, then you classify 7 out of the 10, then you classify as on the scale for that, on the scale for that diagnostic condition, and they will just kind of diagnose you with such, right? So, like I said before, with symptoms will be different when you're comparing people who suffer from depression, right? As a baseline, a feeling of hopelessness combined with a loss of interest in hobbies and favorite activities is a good indicator. So, one of the two symptoms that people really don't talk about a lot with depression that can be most debilitating, and as a therapist, I have to talk about these two symptoms a lot with my clients. And one is hopelessness and one is helplessness. Because if you feel helpless and you feel hopeless, sometimes it's really hard to step over that. And I'll talk about that more. So, again, not therapists. Well, yeah, therapists will diagnose depression as a mild, moderate, or severe. Mild is when the impact of depression on your life is smaller and you're able to at least function at work and in social situations, right? So you can walk around mildly depressed if you're working and you're social. And again, sometimes that can be couched in the idea of loneliness. Moderate is when the depression starts to make a big impact on your life. And by then you're probably noticing, this isn't just loneliness, this is something else. Severe is when the normal activities become next to impossible. I had a client, older client, who was so depressed that if she went out of her door, walked about 10 steps, she was the at the garbage can, like the large dumpster. Client was so depressed that she could not walk those 10 steps to take out the garbage, and her home was piled full of garbage. So much so that there was a threat for them to kick her out of the home. Fortunately, some people from the church came to the home to help her get those things moved out. And this was a client years ago. Um, she's doing much, much better now. Okay, and so some of the symptoms of psychological depression are persistent sadness throughout the day. There's going to be, again, different levels of sadness, but if you are, and sometimes it's hard to catch. So what I was going to say, if you're busy, sometimes it's hard to catch that you feel sad because you've spending a lot of time distracting yourself. Becoming disinterested in things and activities you're normally interested in. So, kids that were just hard charging when it comes to sports, had been on teams for most of their days, if they all of a sudden they're not interested and they want to quit. Now, this doesn't necessarily mean your child is depressed, but it can be an indicator of. So, feeling excessively guilty about things that aren't necessarily your fault. A lot of times with depression and anxiety, it's a very egotistical, both are egotistical disorders. They will make everything your fault and they will make it so that you have an effect on everything around you, even things that you can't control. Being unmotivated to do anything. For some people, this is a huge eye opener because they go from being very active to not doing what they, you know, need to do. Some people stop doing their everyday hygiene activities, having difficulty combing your hair, difficulty brushing your teeth, showering. All those things become really, really difficult. Cleaning your room. You can always tell a depressed person by their room. I've seen several TikTok videos of people who talk about their depression and the chaos around them, which I really love because sometimes people don't understand that chaos in their surroundings is indicative of them having depression. So I love seeing those videos out there, and then the cleaning videos they do once they're trying to just kind of reorganize their lives. Um, Feeling indecisive about everything. You wouldn't think having difficulty making decisions would be a sign of depression, but it is. Especially when you were previously very decisive, and could, make decisions without all that oscillating back and forth. Being irritable or grumpy. You see this a lot in kids, which why kids don't get diagnosed sooner is because parents will say, well, they have had an attitude here lately. Well, that attitude for some kids are indicative of something. It's indicative of something. So you might have to ask more questions, especially if you don't have a typically irritable or grumpy child. There may be something going wrong. Um, Sudden urges to cry or tearfulness, not enjoying things like relaxing or watching movies, especially your favorites. Like when you lose interest in doing things that typically bring you joy, and that can always lift your spirits, you definitely want to start to ask yourself questions. Being anxious about things and thoughts of self harm, to include suicidal ideation. All of those are signs of depression. Some of those can be, again, low grade or high grade, but you want to pay attention to them because either one, you're, especially when it comes to you losing interest, feeling hopeless and helpless, those those symptoms can escalate quickly and you can be in a situation where you're not making good decisions for yourself. Okay. So the nature of some of these symptoms also means the person's social life will be affected as well, right? And those social symptoms include not getting along with family because of the irritability, the frustration with people, the wanting to isolate, participating less in social functions, most especially family functions, where you had a cousin that was typically social and all of a sudden you can't, they are not going anywhere any longer, not hanging out with the family, not hanging out with you. That can be a big issue. So, avoiding your friends and having problems communicating at school or work are also symptoms of depression. Some of that sensitivity also, like there's people who are struggle with sensitivity when there are things that wouldn't necessarily bother them. All of a sudden, they're bothered by things because, again, they're like sometimes you do with anxiety, you're assuming a meeting or you're taking responsibility for things that are just not yours to take ownership of. So, knowing what symptoms that can indicate depression is one thing, but actually, seeking out an accurate diagnosis is something else. And so, just like I spoke in a previous video, like getting some psychological testing can be helpful. But I will be honest, psychological testing to diagnose depression might be a little bit extravagant. So I think maybe going to a psychiatrist to see if you can get that diagnosis. Your therapist and the PhD level therapist can also give you the diagnosis. So anybody at any level can pretty much give you that. And I guess it's such a common diagnosis, you really can't. There's not a lot of nuances, and it's kind of obvious because one of the things I always tell clients is depression and anxiety have patterns, and you can pick up those patterns easier than you can in those disorders that are kind of really complicated. So, um, and really, if we're just being honest, now that I'm talking about it, there is no test for depression anyway. And I think, again, because it's such a pattern thing. Now, there is a test for anxiety. Not a lot of people, I think that one too might not be worth paying all that money unless like there's an education issue because a lot of times ADD, ADHD, and anxiety can be couched in the same thing. Kids will have an ADD or an ADHD diagnoses and they're really anxious. So it's important to get help with depression if you recognize some of the symptoms and they don't go away, right? And you have thoughts of urges of self harm or other forms of destructive behavior, or your mood is starting to affect relationships with friends and family or coworkers. So, one of the things inevitably I try to tell clients when it comes to depression that hopelessness and helplessness will soon turn your brain into like this swamp of negativity, and eventually your brain is going to go to the place where it starts to think about death because hopelessness tells you there's no way out from this kind of depression. There's no way out. There's no help. You'll always be depressed. There's no one out there that can help you. And that helplessness will kick into overdrive and it will especially feel, for lack of a better word, oppressive because when you don't have motivation and you don't believe you can do something, so your efforts to actually do that something is going to fall short because you don't have the belief in it anyway, right? And so, with all that going on, your efforts to feel better, more times or not, are going to fail if you're not taking medication, if you're not working with a professional, and if you're not intentional. Sometimes depression can sound so defeating that sometimes when you talk to people that are depressed And I'm not laughing because it's funny, haha. It's just really ironic because sometimes when you're talking to a person that's depressed, like some of the comments can be so existential. You start to think like, wow, that was. You start to think that that might carry some like philosophical weight, and you start thinking it through. And as a therapist, I have to catch myself like, whoa, 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 that's coming from a depressed brain. Walk it back some, right? So I just have to remember to just kind of walk it through and bring the client back, because like so again, it goes back to the idea of feeling hopeless. Like it's really difficult to convince someone that their brain is basically Jedi mind tricking them, and so this way of thinking isn't going to be healthy for them long term, and that they have to just kind of really challenge their brain. Like the amount of time I spend telling people to just kind of talk back to themselves, to challenge what they're thinking, to have conversations with themselves. Because a lot of the stuff you just can't let happen in your brain. You have to just kind of do a little fighting back. And so the next thing I want to talk about, because like I know the title of um this video is motivation takes movement, and so that's really a hard thing for depressed people to feel motivated, to feel physically and mentally motivated enough to like complete things, right? You have to think about it like brushing your teeth becomes a task, right? And I often have to mention this to clients because they're very embarrassed to mention that they're not brushing their teeth or they're not taking baths. But I can always tell when they're not. Like a client will come in session and I'll see it. I often tell them there's a heaviness that comes with depression, and that's why motivation is important, or trying to create some motivation, because it's not going to happen intrinsically. It's just not. And so, because depression is so heavy, at least it appears to me as the person looking at the depressed individual as though it is heavy. And I'm assuming from some of the descriptions that I've had from patients that it's also heavy to them, right? Because they talk about it. And it becomes really, really difficult. Like rooms with petrified food, or some people are going to the bathroom with buckets on the side of their bed. Like that's how heavy depression can be. So, a lot of times people have trouble moving during depression because they are waiting for motivation. And I always say this cheesy thing, and I think I've said it in maybe a couple of the videos. I can't think if it was year one, year two, because I'm always repeating the same corny antidotes. But it's about motivation takes movement, and there's MOV, move, no E, in the name of motivation. Just move. Like if you're laying down waiting to feel motivated about something, especially when you're depressed, it's not going to happen. So you just need to move. And just as a side, even if you're not depressed, motivation takes movement. So, anytime that you're looking for inspiration or motivation, it's not going to happen unless you're actively doing something to be inspired, or actively doing something, you're moving. So that leads me into my conversation about behavioral activation. So, behavioral activation is a structured, brief psychotherapeutic approach that aims to increase engagement and adaptive activities, right? So, adaptive is positive, which often are those associated with experiencing pleasure or mastery. Decrease engagement in activities that maintain depression or increase risk of depression, right? So, drugs, alcohol, self harm, those are all um, activities that will just kind of maintain or increase your depression. The third thing is it will help to solve problems that limit access to reward or that maintain or increase adverse of control, meaning you have to do activities that make you feel good about yourself. Like if you go and you do activities or at least bring you pleasure. So if you go and you do activities like if I'm depressed, I'm not going to go and play Serena Williams in a tennis match because I'm going to lose. And the likelihood that when I lose, I'm going to be even more depressed because that's going to trigger that core belief of me not feeling good enough. Because, Serena beat me in tennis. Um, it's all bad. So I don't want to do that. So even if you start off with something small, just start off with something that will bring you pleasure and something that you will do well so that you can just kind of boost your esteem and just boost the likelihood that you're going to do a thing again. So the main idea of behavior activation as a treatment is to allow patients with depressive symptoms to learn to cope with their negativity and increase positive awareness through the redevelopment of personal goals in the form of short, medium, and long term life goals, right? So you don't want to bring someone out the gate and say, hey, you've been depressed for a long time. The goal is to um, ask for a promotion at work um, in a job that you're not really familiar with and just kind of go and see what you do. Because again, that's setting them up for failure. But for a person that can't get out of bed, a lot of their behavior activation is going to be centered around them successfully completing their daily hygiene task, right? Starting simple, starting on a mental health walk. I'm trying to figure out why I always call long walks mental health walks. I think because they make me feel great. Other than that, I don't have a reason. So in this, if I ever say mental health walk in any of the other videos, that's what I mean. I just mean a long walk, a walk that's probably over a mile or two. Um, because it's really, really good for your mental health. But I wouldn't start a depressed patient off at a mile or two because that again will set them up for failure, right? So this, the BA is the type of intervention that is most often used to treat depression. I've said that several times. It's because it focuses on behavioral change in everyday life, right? It has interventions that might involve helping a client plan more activities they actually enjoy. Again, not activities that will make them feel bad about themselves. Helping them develop their social skills or generally having the client track their own emotions and activities. And so just as an example, because I don't want to lose the definition in this. So when the client does an activity and you're actually tracking the activity. So once you do the activity, you gauge how you feel. Like if I go dancing at a new place and I'm learning to dance, my level might not be as high as if I'm going to a Zumba class and I'm just getting in where I fit in and just kind of having fun. My score will be higher because there's no pass or failure to that. That's me going out and having a good time, moving my body, laughing with other people. And so, again, you're looking for activities that will help to create joy and more motivation. And so the reason why behavior activation works is because behaviorists absolutely feel like depression is a behavioral issue as opposed to a cognitive issue. And I don't know. I can see, I'm not opposed to it. Like I can see that. But because I'm one of those people who feel like um, your brain your brain is so powerful that it'll just kind of stop you from doing things or it'll help you do things. But I can absolutely see the behavior issue in depression because it has a lot to do with your body. So I think the more I talk, the more I realize they might be right. Even though I really just, I'm a brain kind of girl. So I may have to do a little bit more research outside of my research for this video to to just kind of educate myself a little bit more. So, since the a behavioral model could be subscribed to depression, it's believed the best way to treat depression is to restore an adequate schedule of positive reinforcement for the person that's changing their behavior or their environment. And so that's just a fancy way of saying is get them back moving again, doing positive things that again create joy so this person can understand, hey, when I was moving around and I was getting myself out there, I felt a lot better. I think I want to go out and do this stuff again. I appreciate this. I liked it. I felt good about things. Um, and so that that is one of the components, if not, well, it's one of the most important components, right? Um, behavior activation is also a part of cognitive behavioral therapy. I've mentioned that in a couple of the videos. So, cognitive behavioral therapy, I think just a previous one too. Cognitive behavioral therapy is just a way to, it's just a therapy that helps you to understand that your thoughts and behaviors affect your feelings. And that if you change your thoughts, you can change your life. And that's my favorite, which is why I was just kind of having that whole conversation about depression and behavioral. Um, so behavior activation, is also the driving force behind the efficacy of CBT, right? Because if you go out and if you're doing things and you're feeling better, you start to feel better about yourself, right? You start to think better about yourself. You still want to work with a therapist because a lot of times when you believe a certain thing about yourself, it's difficult for you to go and overstep that because a lot of us operate within negative and positive belief systems. And because we're human, and the whole thing I tell you about the brain being a negative environment is that we're going to lean more towards those negative um, belief systems versus we're going to go to the negative versus the positive, right? And so we need to use we need to use these positive behaviors to continue to encourage us to keep it moving, right? So one of the examples is there's a 16-year-old girl named Amy with depression, right? Amy and her mother um, go to a therapist to just figure out what's going on with Amy and just to discuss what looks like depression. The depression is stemming from Amy's father's recent death. The mother is also ill and she has symptoms of fatigue, um, academic workload. Her fatigue was of a particular interest as it kept her from doing positive reinforcement activities, right? And I'm talking about these symptoms in regards to Amy. I think I said her mother, but I meant Amy. So since she felt tired, she wouldn't go hang out with friends, and since she wasn't hanging out with friends, she would feel bad, and this bad feeling would lead her to have low energy levels. It's a vicious cycle. I often tell clients that it is a vicious cycle. And a lot of persistent mental illnesses or persistent thought disorders are cycles. They work in tandem with one another, and that's why it's very important to change your thinking, right? So, along with this, so what'll help Amy ultimately is helping her find more positive reinforcement in her social life, right? So a personalized activity schedule will help her with her depression, meaning like what are you going to go out there and do? Let's talk about activities you can do. Let's talk about how you feel after you complete the activities. Getting her out, which is why so many parents yell at kids like, get out of your room. The more you get out of your room, the more you feel better. And let's be honest, if your family is a trigger, then it's not going to help you to come out of your room and have them consistently trigger you. And then you want to go back in the room and you're going to start to feel more depressed. So try to do things that are not couched in your triggers so that you can just, set yourself up for uh, fail. I mean, just set yourself up for success, right? So some of the techniques that can be used in behavior activation, and I'll just give you these as an example. So if you're working with a therapist, you'll understand, hey, some of these things might be missing or they don't sound familiar. So self-monitoring of activities and moods, activity scheduling, activity structuring, problem solving, social skills trainings, hierarchy construction, meaning ranking how easy certain activities are to accomplish, shaping, training healthy behaviors, reward, persuasion, because we do have to do a lot of convincing when you feel depressed, a behavior contract, signing a contract with friends and families so that they'll help reinforce your healthy behaviors. They'll get you out, they'll get you outside, and then a life area assessment. So determining which areas of life you desire to have more success when it comes to feeling a little bit more motivated and getting yourself out there so that you can train your life. And so, that in a nutshell is behavior activation as a treatment for depression and why I think motivation takes movement. And I will see you guys in the next video. Bye.